So last year, the hospital transparency rules went into effect, which require that hospitals are to have documentation on their website giving consumers pricing information for their services. They are required to provide a comprehensive machine-readable file and a more user-friendly display of shoppable services. The whole reason this rule exists, as stated from their CMS website, is to, quote, make it easier for consumers to shop and compare prices across hospitals and estimate the cost of care before going to the hospital. In recent years, I've noticed a surge of activity from employee benefits brokers and consultants who have begun to speak out against the rising costs of healthcare and even reject traditional models of insurance in favor of solutions that eliminate third-party negotiations that have failed to keep costs in check. Why? Brokers, unlike any other segment of the healthcare economy, are most closely connected to the cost of care because they are the service provider that is most closely connected to the end user, the member, the employee, and the employer. They see employers who struggle to be competitive while also maintaining or managing health insurance budgets. They see employees who struggle to select the right health plan by balancing their family's healthcare needs against a household budget. They see the plan member who comes to them in a panic with medical bills in the 5 and 6 figures. Traditionally, brokers have been the industry experts that employers and members rely on to provide them with the calculus that will enable them to find the sweet spot between benefit and premium. But at the center of these two concerns is the cost of healthcare directly. We can only shift between premium and benefits so much, so many brokers are figuring out that tackling cost directly is the most effective way forward. When it comes to the actual healthcare services that members use, brokers want to be able to help their clients in two ways. First, they want to be able to provide the tools and resources that help employers and members identify high quality and cost-effective medical services and providers. Second, they want the ability to help their clients negotiate for a fair price for their healthcare services. It's always seen as a win when a broker can negotiate a lower payment for a plan or member, but what's not always clear is what the true price should have been. This is because prices become convoluted through countless separate payer contracts, unbundling, and complex billing codes, and lack of usable data that keeps everyone on the same page. The kind of data that is promised in the hospital transparency rules is exactly the kind of data that we need. The problem is that much of the data that is currently being provided is unnecessarily messy and unfit for comparability. It's important to stress that one of the stated purposes was to make hospital charges comparable to support decision making. And what decisions would we want to support? Well, there are 3 of them. Which hospitals, which procedures, and which insurance policies. Let's take a look at some examples. And as a courtesy, I won't mention most of these systems by name, but this is a public chargemaster for a hospital system in the eastern United States. As a side note, you can find these by going to the website of any hospital and in the search bar use key terms such as chargemaster, standard charges, or just charge. There are 4 things that I would note about this chargemaster. First, it's not user-friendly. The data is somewhat usable for a data scientist, but it does not offer the average consumer any useful information. We have lots of technical jargon and approximated prices. Second, it has no insurance information. We have no way to break costs down based upon an insurance company's payer contract. Third, if you look at the last column here, M, it seems disingenuous if you look at this column. One of the rules under the hospital transparency is that these chargemaster documents are required to list the de-identified minimum and maximum charges. What this means is that the document must provide data identifying the highest and lowest charges it has accepted for any given procedure code. While this document seems to be following that requirement from a technical perspective, it's treating the functional write-offs as a minimum in order to obscure the true relative range of cost. A third column indicating some central tendency of minimums would be more useful. So, for example, the lowest price it has received for this procedure that has a maximum charge of $1,200 is 1 cent. That may be true from a technical perspective, but that's not really useful information because the average consumer can expect that they're going to generally have to pay more than that. Fourth, it has several columns of data with no information. This is a missing values chart of some of the same data. The blue bars measure the amount of missing data. The longer the bar, the more data that is missing. In short, this document promises 4 columns of data that it never provides. Here is a chargemaster for another hospital, this time in the western United States. This chargemaster does provide insurance information. So, for example, here you can see we're referring to insurance payer contracts. And that's good. However, it is loaded with self-referencing calculations. So if we look at column K right here, for example, we get the information of 78.41% of total charges, of total gross charges. A calculation would have been more helpful here, especially given that this is Excel. A member would have a lot of confusing, busy work in dealing with this data. It also has a messy footnote system. So, for example, we see this IP reference here. You can see coded terms such as the asterisk or these IP terms. You have to scroll all the way to the bottom of this document, which is huge, 28,000 rows before you get the key. So now for a good example, and I will list this system by name because they are doing a great job. This is the Robert Wood Johnson Hospital System in New Brunswick, New Jersey. First, I should note that their website is incredibly useful in providing several consumer resources. This is just one of their many consumer and researcher-friendly documents, but it is the most comparable with the previous examples because it is the standard chargemaster. It's actually so good that there isn't much to say about it. The column data is incredibly clean and consistent. It simply lists prices. So as we look at the columns, you have a single data type. You have a price. It provides insurance payer information. So across the top, you can see the insurance payer. And again, consistently, it provides that data with prices. It's pretty basic. You look up a procedure, you find the payment columns, and then you get a price. This is what transparency looks like. When we talk about transparency, we have to remember that it's about more than just data. Organizations that have an obligation to provide transparency need to be thinking about the end user when deciding how they will present their data. As price and quality data becomes more transparent, the market will be energized with services, tools, and products that will enable people to obtain the highest quality care at the most efficient prices. We will be able to reduce price variations and narrow in on the true cost of care.